Hi everybody, Healthy Prepper here. Today I'm going to discuss some basic medical supplies that I think are important to have on hand in case of an apocalyptic pinch. Now this is going to be the scenario where you don't have the normal walk-in clinic or doctor or hospital to go to. This is you on your own trying to figure things out. And these are basic items that you may or may not already have at home. You may want to think about collecting some of these along the way just to prepare yourself, because these might be times where we're going to be put in the position to have to do things that we're maybe not familiar with or comfortable with, and it's good to have a little bit of an idea first of what we're doing. Okay, so let's get started here. First, I'm just going to go over some absolute basics. You need bandages, all different kinds. You can get latex-free, it doesn't matter. Start getting a good stock of these, because small little cuts, tiny paper cuts, cuts from using tools outside, can become very bad situations if left unchecked, especially in an apocalyptic pinch. So I highly recommend getting a wide variety of these. Get some of the plastic covered ones and get some of the fabric covered ones. You'll find they work better in different situations. I find that the flexible fabric ones work very well on fingers that tend to get wet a lot. If you're working with water, they tend to stay on better. So get all sorts of different kinds, and along with that, you're going to need some gauze pads of all different sizes. You can also use Kotex maxi pads for large wounds. If you have a big gash or a big wound, get the kind that doesn't have any scent or fragrance on it, and you can use this to put on top of the wound, and then you put pressure on it, and you can even wrap with an ace bandage around that, like if it's on a leg or something, to keep the pressure on it. All right, so those are just some basics. This is something called Quick Clot. It's basically if somebody gets an injury, a big gash, possibly while being outside in a sporting environment, but obviously we'll be using it in a apocalyptic pinch situation. You just open this and apply it to the wound like a pressure, and it will automatically start forming a clot much faster than your body would normally. So that's a good thing to have. You really want to use this just on bigger gashes. Little tiny things should be addressed with smaller things like bandages and that. Next, I want to talk about some antibiotics, and I think that in the world of antibiotics, it's a good idea to have some on hand. Now, there are different ways to acquire these. You can go ahead and just ask your doctor, I want to have some antibiotics on hand in case of a bad situation. You know, it depends on the rapport with your doctor. Some people get these from pet feed supply places, animal supply stores. Some people purchase them from Canada, some people purchase them from Mexico. There's a lot of different ways you can get these, but I highly recommend that some way, shape, or form you have some antibiotics on hand, because infection will be rampant and you will need antibiotics to save lives. So here's just some ones that I recommend that you have on hand. And I would say that the first one I think everybody should have on hand, if you can only get one, would be Cipro. I think Cipro is a good all-around antibiotic. It can be used for many different things, such as sinusitis, sore throat, pneumonia, intestinal infections like diarrhea, food poisoning, skin infections. It's better for some things than other, but it does have a very wide, what we call a spectrum, so it can cover a lot of things. If you could only get one, I would get Cipro, and it's usually pretty inexpensive. You can either get it for, I think, $4 at Walmart, the generic, or some of the pharmacies are actually, I think it's Publix that's actually offering it for free with a prescription. So you definitely want to have some of that on hand. Another one I recommend, which is a little more expensive, but I think it's a great idea to have on hand, it's amoxicillin with a kick. It's called Augmentin, and it's a good idea just to have plain amoxicillin around. That's like penicillin. But I would recommend, if you can get some Augmentin, this is plain amoxicillin with a little extra piece on it, which makes it Normally there's some antibiotic resistance out there, and it makes this antibiotic much less resistant to the resistance. So it's good in an apocalyptic pinch, and it will also be very good for skin, mouth, sinus, sore throat, chest infection, some urinary tract infections, things like that. So Augmentin, if you can get a hold of it. Amoxicillin, if you can't. Amoxicillin is very inexpensive. The next one I would recommend having would be metronidazole or Flagyl. This is a wonderful antibiotic if you've got food poisoning, nausea, vomiting, diarrhea, and it's not going away after 24 to 48 hours. So that is good for that. And with the bad water we might be drinking and things like that, it's very good to have some of that on hand. This is plain old erythromycin. It's an older antibiotic. It's been around for years. It's used a lot in the vet industry. We still use it in humans, but not as commonly. We have stronger and fancier antibiotics now. Biaxin is a big brother of erythromycin, a little fancier, a little stronger. But that will be good for your basic sore throats, sinus, lung infections, things like that. Now this one is Biaxin. Like I said, that's the bigger brother. That's if you're a little more sick and you're going to have a bad sinus infection or pneumonia or something like that. And let's say your Augmentin or your Cipro is not working, you're going to want to have something else to fall back on just in case. Because you're not going to know. You're not going to be able to take cultures or have any help possibly to figure out what's going on. So you may need to try different antibiotics. All right, now here's another one I think is important to have. This is Doxycycline. This is an age-old antibiotic that still has huge value, and it's very inexpensive. And this will cover everything again from sinus, sore throats, lung infections, gut infections, but also anthrax. So this is a good thing to have on the shelf. Also Cipro can be used to treat anthrax as well. So keep those in mind. You never know what we're going to be facing. Although I think the likelihood is low, but never hurts to have it in a pinch. And also some type of antifungal medication. Or if somebody gets a really, really bad fungal infection, yeast infection, something like that, having some antifungal medicine in pill form is good. Sometimes topicals will not work, so you need something stronger. So those are the things to acquire if possible. Do your best out there. And here's a few other things I like to have on hand. Some tools. I came across of these actually at a garage sale. And I bought a whole bunch of them. There was a medical clinic going out of business, and they were selling off some stuff. So these are needle drivers. Now you may have never seen or worked with a needle driver, but basically it's like a little clamp, goes together, and it's smooth on the inside. Nope, that one's not, sorry. This one's a needle driver. They look the same. Okay, this is a needle driver. It's smooth on the inside. And here are the needles that you use when you're trying to close something together, so two pieces of skin together. Now look at the picture. The needle is curved. That's actually what the needle itself looks like. So you grab the needle and you use it to go through two sides of the skin. Through the first side, second side, and then you're going to start to sew. And in an apocalyptic pinch, you just need to get the two different edges of the tissue that's apart, you need to bring them together. And whether you do that with the fancy way of needle driver and suture material, or you tape them together in some way, shape, or form. If you have nothing else, and it's just you in your garage, look for duct tape and put some kind of padding, put some antibiotic ointment and hydrogen peroxide on there. Bring the two pieces of tissue together, put some padding, some gauze, something like that, so the duct tape doesn't stick to the wound itself. And then you just tape it across. You can use masking tape, duct tape, doesn't matter. You just get those two pieces together, you let them rest. Usually anywhere from 7 to 10 days, and you've got a nice adherence there, so they'll stick together. So any way you can bring those pieces of tissue together. You're going to want to clean the wound somehow initially before you bring them together, and that's where you might want to use some antibiotic ointment. You might want to flush it with some normal saline solution first, antibiotic ointment, possibly a little hydrogen peroxide. It's not the perfect way to treat a wound, but we're talking pinch here. So clean it, bring the wound together, put some more antibiotic ointment on top, cover the wound, and tape it down so the two pieces stay together. Other things you might find helpful that I came across at that garage sale were these are pickups. These can help you pick up anything from little pieces of, if you're working on tiny pieces of tissue, you want to lift up a little piece to help suture, you can use this. You can also pick up needles with it, tiny little things. These are very handy to get. So tiny little instruments like that. Some surgical scissors just to cut the string, not absolutely pertinent, but nice to have because they're tiny and thin and you can work in small places. Also got these. These are dressing cutters. So you're going to find that in a dirty environment you're going to have to change dressings 2 to 3 times a day possibly. If in a horrible pinch you can only do it once a day, you do it once a day, but you really stay on top of it and keep it as clean as possible and keep flushing with hydrogen peroxide and triple antibiotic ointment. So this you would just slide into the bandage that's already on and you start cutting. It's very blunt. It's not going to injure anybody on this side. Okay. It's a good idea, if you can, you don't have to get all these things, but if you can, to get a surgical set. Now you're saying, wait a minute, I'm not a surgeon, I can't do any of this stuff. That's okay. It's always good to have versus not have, and you never know, you may have somebody who joins your group that happens to have these skills, so it's good to have on hand. And it's also good to learn some of these things as you go. You will pick up things, and honestly, these processes are not that hard. But this is a basic surgical kit, and it has a lot of the tools I just showed you, needle drivers, clamps. One important thing will be your surgical knife, which you're going to use blades with. You usually have a round blade and a pointy blade. Oh, I'm showing these to you upside down. A round blade and a pointy blade. And a flashlight, that's very good so that you can actually see what you're doing. Some basic wipes, alcohol prep pad, and antibiotic ointment. So that's good to have as well. Now you'll find that some of these suture kits come in a package. These are not sterile, neither are these instruments that I bought at the garage sale. So in an apocalyptic pinch, I would recommend doing the following. I would take these instruments, here's a way you can keep them as sterile as possible. Everything's going to be as sterile as possible in this kind of situation. You're not in a surgical suite where everything is, you know, almost completely sterile. So we're going to do the best we can. And one way to do that, pre-boil these things ahead of time. And if you can, get a food saver vacuum seal bag, put the instruments into the vacuum seal bag with an oxygen absorber and seal the bag. And that's going to be a really good way to get them as sterile as possible before you break the bag open to use them. Boiling is always a good idea. Some things nice to have, which are dental kit, emergency dental kit. This has all sorts of items in it that are going to help you if a filling comes out, you know, if you've got an abscess, things like that. It's got some, you know, aerosol gel and things like that. Temporary fillings. Better to have than not have. Honestly, these things probably don't work that well. They don't last that long. The temporary filling's going to fall out until you find somebody who can do something about it or just pull the tooth out. But it's better to have than not have. So I also recommend strongly to get all your dental work done before any apocalyptic pinch. So you don't want to be the one standing there with a really bad toothache when you're trying to save your life and everybody else's life too. This is handy to have, Topicaine. It's numbing gel for the tissue or the skin. So if you do have to if you do have to stitch somebody up, needle and thread, you numb the skin a little bit. Basically, it's just a cream. You can buy this online. Put it on the skin, It'll numb it up a little bit, and then you do your suturing or your sewing. Another nice thing to have, not absolutely necessary, but really nice to have, it's called a Bovie, and this is an electrocautery device. It's going to look like an electric pen, and basically you just pull the cap off, and it's going to give you like a solder tip. And let's say you're working away and these little tiny bleeders keep filling the site that you're working in, trying to sew things together. You can't see what you're doing. You just solder or cauterize the little bleeders. And in an apocalyptic pinch, if I didn't have one of these, I would use a soldering tool if I had some form of electricity. Also, if you don't and you have fire and you can heat some type of piece of metal, could be a knife or anything like that, you can put it in the fire, get it very, very, very hot. This helps get it sterile, but it also acts as a solder or cautery tool. You can place that on a tiny blood vessel that's bleeding, and that will help stop the bleeding. Okay, so those are some basics, and I would also recommend maybe to have some type of needle, just in case you do have to give any kind of injectable. This might be handy to have. This little 30 gauge needle is one of the smallest, thinnest, tiniest needles. It's great for anybody who's scared of needles. And you can get different sizes in those. So if you feel comfortable getting that, that's a good idea too. I recommend getting some type of satchel. I got this at a garage sale. It's a sack. Kind of looks like a doctor's bag. Only paid $1 for it. Nice leather sack, and I just throw everything in there, and it's ready to grab and go. So if you need something, quickly grab and go. Treat your medication like gold. You only use it when you absolutely need to use it, so try to treat things topically first if you can. Say if you have a cut, try the hydrogen peroxide and the triple antibiotic ointment first. If the area does not seem to be improving, if there's more swelling, there's red streaks, things like that, the person starts to get a fever, the area seems to be increasing in size, start the antibiotic pills. You're going to need those to save that life. So there are others out there as well, different antibiotics, but I do recommend you get some type of antibiotic for your apocalyptic pinch medical pack, and just put them away. One thing that's very important to check with people before you give them an antibiotic is do they have any allergies to any antibiotics? And obviously you don't want to make a bad situation worse by giving them something that would make them more sick. So find that out first, and also it's a good idea to have some type of pain medication around in case somebody breaks a bone, something like that. But I would use these incredibly sparingly, and definitely be careful with those. Obviously they're highly regulated and scheduled, and you need to be very cautious in using this type of medicine. So layer in your pain medication. I mean, Advil and Tylenol, they work well as first guns, so definitely have that on board, and aspirin. And it's a good idea to just have a general idea of everybody's medical history that you have in your home, as far as, is anybody a diabetic? Does anybody have a heart problem that we know about? Discuss this openly with your friends and family, and see if, everybody can just get an idea. There's obviously a lot of issues about medical privacy and this and that, but in an apocalyptic pinch, you're going to need to know what's going on with people. So if they're willing to give you that information and they give it to you voluntarily, you're fine. Okay, so there we go, folks. I think I've covered everything here. So this is Healthy Prepper signing out. Get your goodies, keep them on hand, and make yourself a fantastic medical kit so you can sleep peacefully at night. Take care, everyone.